We just couldn't. And this is how good she is. Our next guest, she just did a full checkup and cleaning during that break. She did Jane first because of the concern about my cold. She goes, I'm in people's mouths all day. You couldn't make me sick if you wanted to. Introduce her, please.
I'm still drooling, all that good stuff. Well, of course, she's the dentist of all dentists, Dr. Lauren Zalay. She is from the University Associates in Dentistry. Dr. Zalay, thank you for joining us here on the Steve Cochran Show.
Thanks for having me again. I love it here.
Really glad to have you. And we want to get to the Halloween and all that other stuff, but we have a staff problem.
An emergency.
That's a 911. So in your headphones, you're going to hear Nick Gale, our news guy.
He's not even here today because he's in such pain.
Yes. Nick has a tooth that has been haunting his face and the rest of his head for well over a month, maybe longer.
Yes. Yep.
He's had scaling and planing. He's had, if not 1, 2 root canals. It is still going on, and he has taken the entire Advil factory at this point to manage the pain, which, of course, can be tough on his stomach. So, Dr. Zalay, you got to help him. You got to save Nick.
Nick, I feel for you.
Thank you.
Well, it starts with sympathy and empathy. It does.
Nick, tell Dr. Zalay what you had done yesterday and what you're feeling like today.
I don't remember what it's called, but essentially, he went between the tooth that was I had an abscess, whatever. So they did a root canal there. Then the infection came back. So what he did yesterday was he basically cleaned between the gum and the tooth. I want to say he called it abrasion or debrasion or something like that.
Okay.
But he took a little laser and kind of burnt stuff in there and supposedly to get rid of the infection. And now I'm on round 4 of antibiotics.
I mean, he's got so many drugs coursing through his system. With this flaming infection in his mouth. After all these procedures, he's got to see you. He's got to see somebody else.
Well, let me just say, this wasn't on the dental board exams, but I'm going to take a flyer here. First of all, we'd love to see you at our office. But second of all, I'm thinking the tooth is fractured.
Oh.
Well, that makes sense, right?
The tooth that they did the root canal on is fractured?
Correct. Yes.
Well, and that was a warning to me that with this temporary filling, right, before I can get a crown on it, they said, be careful how you bite because it looks like this could break up into 3 pieces. But as of now, I'm told of the recent X-ray, yes, I can't even talk, X-ray yesterday, it doesn't appear to be fractured.
So I'm going to suggest you come to University Associates in Dentistry.
Should something like this be going on for so long, I think, is the question. And because it is going on for so long, what should he do next? Just continue to take the antibiotics and the Advil and wait for it to go away?
He's got to stop taking Advil. He's going to have a hole in his stomach.
I'm thinking a month is kind of a long time here.
Yes.
Give it a week or 2, but after that...
Well, let me ask you a question. Why wouldn't they just yank the tooth?
I don't know, Nick.
It's number 28.
He keeps asking them. Oh, number 28.
Oh, number 20. I love number 28. It's beautiful. Have they taken a CT scan? Do you know? It goes around your head.
Yes, they did that yesterday. Mm-hmm.
Oh, interesting. Once again, going to recommend University Associates.
Okay, where are you guys located? How do we get a hold of you?
I will see you today. I will get you in. No problem.
All right.
They're right here close to the station.
Yeah,
yep.
So we're going to get you the contact info.
Yes, I am happy to see you. We will figure this out.
He's actually in the burbs in his home office, but I know he's here tomorrow.
Okay.
And
maybe.
Well, unless he dies in the night. And we certainly hope that's not the case. Does a random tooth occasionally kill an individual? Not so much?
Usually not, unless you have a blood disorder.
Okay.
It goes into your bloodstream.
Yeah. Teeth are pretty easy, right? You just got to take care of them.
Yeah, I mean, this is bad, though.
I know.
This
We've been dealing with it.
Oh, I feel worse for you guys than him.
No, I feel bad.
Because I hear me bitch about it every day.
No, Nick's our friend. He's been in pain for over a month.
So a month is just a little long on my timeline here.
Okay.
So
he's been in pain for a month.
Yeah, and are they sure it's that tooth and not another tooth? Have we looked at the other teeth?
Don't know.
Okay.
Good question.
You know what else?
Great response.
You know what else? You'll be the person that can say these are the questions I need answers to, as opposed to expecting Nick to come in with questions, because he can only talk till 9. After that, it's because he's in pain.
He sometimes learns.
Thank you, doctor.
No problem.
Dr. Zalay is a geek for teeth, so you can really ask her anything you want.
All right, so let's do Halloween.
Okay, let's do Halloween because we always talk about Halloween.
I love Halloween.
How much candy is too candy? Can I eat candy all day long?
You cannot eat candy all day long.
Well, here's the thing. We're going to go trick-or-treating. The kids and the adults will eat some candy. Do we have to brush right away after consuming the candy and getting all the sugar in our teeth? Or can we just wait till the nightly brushing?
So Halloween's around, if you're trick-or-treating around 4 or 5, you're eating candy as you go. Are you eating dinner after that, or did you eat dinner before?
Both.
Great. So I'm thinking about a half an hour after the candy, you're brushing your teeth.
Okay.
Otherwise, you're asking for trouble.
Exactly.
A half hour. So let's say this. You have the dinner, you go trick-or-treating, you're eating some candy, then your bedtime isn't for another hour or two. You can't wait? And why? Because the sugar gets into your teeth? Like, what's the reason?
Yeah, so you're going to eat the candy, then your saliva is going to get most of the sugar off, kind of swish it around your mouth, and then you're going to brush your teeth and make sure you get off all the sugar.
Yeah, and here's the bottom line. What's the reason and why should we do it? Nick, Exhibit 1.
You're right.
Poor Nick.
Now, I would think because you've got these dental suppliers who are nagging you all day long, don't you have like 1,000 toothbrushes you'd give away on Halloween?
So actually, I wanted to give away toothbrushes on Halloween, and my husband said our house was going to get egged.
Why don't you give away candy and a toothbrush?
That's actually a good idea.
It's kind of an oxymoron.
I know. It's perfect.
No, but you're saying you need to brush your teeth after you occasionally have candy.
Yeah.
And then when you give them the candy, you slap it out of their hands and tell them to take the brush and stop crying.
Let me ask you this. The right order, I love to floss. And I wish everybody liked to floss. But is there an order that you need to floss? Like, I floss first and then I brush. And some people brush and then they floss.
So nobody flosses. So I'm just happy if you floss.
Oh.
Floss, brush, floss.
Oh, you don't care?
It doesn't matter.
Nobody flosses?
Nobody flosses.
Nick, do you floss?
They floss like 2 days before their dental appointment, and they think they're tricking us.
Right.
And then they don't floss after the dental
They
appointment.
come in and there's...
Every time.
They look like a Civil War wound, blood coming out of their mouth.
Like out of 10 people, it's one person?
Maybe.
Wow.
The best is when someone's crown comes off by accident or something, and they're like, well, I was just flossing. I'm like, thank you.
Right. You know what I use? I use those wooden picks all day long.
So you stab your gums. You don't floss.
Well, but the point is, if there's something in there, I'm getting rid of it. Now, I do floss, but I'm just not great at it. I never had braces because they weren't invented when I was a child. And because of that, my teeth are, going in a lot of different directions. So getting the floss in between some of those is kind of got to put a little C4 in there to blow an opening.
So we have an opening later, and if you want to talk about Invisalign, that would be awesome.
Oh.
Wow.
I thought about that.
Well, what about, if your teeth are overlapping, you have trouble flossing, what's the trick? I mean, you want us all to floss, just wiggle it in there?
Yeah, wiggle. I mean, it still goes through. You just get plaqued more easily, right?
So you don't... My teeth have been fine. I haven't had a cavity since I was a little kid. But
amazing.
Which was literally, I haven't had a cavity. I was born in 1961. I haven't had a cavity since 1968. So I do brush all the time and I do pick. I just don't floss every day.
I'm thinking you know more than I know since you haven't had a cavity since 1968.
This leads me to ask you the question, and maybe we can circle back. Genetics versus a lifestyle. So maybe Steve's genetics are helping him not get those cavities.
True.
Yeah.
Genetics are a huge factor. I have some patients who come in, every 6 months and they have cavities and they're like, I brush and floss all the time. What's going on, doc?
That would be great if genetics was the case, because my birth mom, I'm adopted. I've known my birth mom for 20 years. And one of the first things we talked about was, medical history. And they've had everything. Every possible disease on the planet, they've had it. Rickets, scurvy, Ebola, leprosy, whatever. It's all in the pipeline. So if they gave me strong teeth, great.
Right.
Yeah, that's a good thing. Can you hang around a second?
Sure.
8:45, traffic first, and more with a good dentist. Hey, that's a good... CBS should do that show.
The Good Dentist.
Starring Dr. Zalay.
Yeah.
Scurvy?
Yeah.
No.
That's the first
The
episode.
Good Dentist.
Yeah. All right, what's happening? Well, we got a few more minutes with Dr. Lauren Zalay, University Associates in Dentistry. Best way to get a hold of your practice is to do what?
Call us. We answer the phones.
What's your number?
312-704-5511.
All right. Worst candy for teeth?
Ooh, Laffy Taffy. Got to go with
Because it sticks. It's sugar and it just sticks.
It just pulls that stuff right out. Wait, you know what? It might even pull out Nick's tooth. Maybe that's a good thing.
Do it with Laffy Taffy, Nick.
You can do it at home, Nick.
Nick, are you old enough to remember sugar daddies?
Ooh.
Oh, yeah.
Sugar daddies are just these straight sugar on a stick. Mm-hmm. Yeah, and it was like road tar. Yeah. You put it in there and you go, you're pulling it out a month later. You could actually
brush your teeth with the sugar on a stick.
Do you remember jujubes?
Yeah.
Sure.
So I went to a dental convention once, and they had these things that looked exactly like jujubes for people to bite into to take the crowns off of people. And I was like, well, I could just go to a candy store and get that. What do I need to go to a dental convention?
Right.
Smart.
Yeah.
Do people come in with the jujube stuck to their dental implant?
No, they usually finish it before they come in.
I don't know if you can tell us. You probably can't. Here's the question. What's the weirdest thing you ever found in somebody's mouth?
Yeah, exactly.
I'm gonna go with, well, it's a toss up. Lettuce. You know, we see a lot of lettuce between teeth. But I'm going to go, I once had a patient come in with a piece of floss just stuck between her tooth, like shredded. That's been there for like a day. She couldn't get it out.
Oh, good Lord.
I got it out in like 10 seconds.
Well, sometimes you can't get in there if it's too tight.
Well, you got the fancy dental tweezers. You go in there, grab it.
Yeah, or we come in from the bottom and go up, you know?
That's easy.
Instead of going up, down, up, you know?
You told us something off the air, which I find interesting and disturbing, that occasionally you can do your own dentistry in the mirror.
Love it.
Do other dentists do that too?
I'm sure.
But you do it for practice or convenience?
Tell us that story.
Convenience. Well, my front tooth is a little chipped, and so, I had an event the next day, and no one else was around, so I, fixed it in the mirror. No problem.
It's wild.
That's awesome.
The other thing you told us that I thought was very interesting was your theory. I said, so you don't even really care about Halloween candy, because obviously we all know you have to brush your teeth and floss. You want us to do that, and mouthwash a thing just to swish it around. Is that something? But the most important thing for Halloween is
brushing your teeth. What else did I say?
What did you say?
Math. You said.
Oh, yes, math. Math is very important on Halloween.
Meaning?
You got to sort the candies. You got to see which one you have the most of. You see which one you have the least of, right? Mm-hmm. How many more M&Ms than Twizzlers did I get? This is very important, people.
So you're talking about actual candy census technique.
Yeah,
correct.
She's not counting. She just so long as you brush your teeth, like teach the kids how to do math, and then brush your teeth. Now maybe count your teeth.
Now you've got two kids. Your fancy attorney husband, does he do what all dads do? Does he go through the candy to make sure it's okay, and then eat the good stuff?
Yes, he is the worst. He eats everything. We have to hide it under the bathroom sink so he doesn't take the pumpkin full of candy.
The good stuff.
Oh, yeah.
I'd
find it. Too. I got chocolate nose. I'd find it.
So do you give out, Steve, I'm sure, you give out full-size candy bars?
Yeah, we actually give away all expense-paid trip to the Hershey plant in Pennsylvania.
I'm going to give out appointments to Dr. Zalay's dental office.
Yeah, 100%. Dr. Zalay, thank you. Number at the office again?
312-704-5511 or uadchicago.com.
Here's to Nick and his tooth.